Good afternoon, everyone, and welcome to our e-forum addressing Islamophobia in healthcare. A few preliminary comments before we get started. If possible, please close other running applications to improve the connection on today's platform. If you are experiencing technical issues, please exit and log back into today's session. If that does not address the issue, please contact us at dei@CASLPO.com and we will try to assist. Today's session is being recorded and will be posted on CASLPO's website under events. And the following presentation is intended for educational purposes. As a result, viewing today's session can be counted towards your self-assessment tool or SAT learning goals. We encourage you to type your questions in the chat box on your screen. Questions will be accepted throughout today's presentation and we'll be monitoring the chat box. So please feel free to enter those questions. You do not need to wait for question period. Time permitting, our presenter today will address as many questions as possible. And as a reminder, we are here to learn and to exchange ideas. And so we ask that your questions and comments be framed with an open-minded fashion. With those items covered, I am very excited to welcome back Dr. Nafisa Jalal to take us through addressing Islamophobia in healthcare.
Thank you so much, Priya. Good afternoon, everyone. I hope you are keeping well, and I am so pleased to be here with everyone today as we go through what I hope will be a very engaging, informative, and educational session for all of you. So with that, we will go ahead and get started. As you can see, today's session is titled Addressing Islamophobia in Healthcare, and we are looking at fostering inclusion for the Muslim community in Ontario. I'm not going to go into any introduction about myself because I think all of you have been a part of webinars and workshops that I've been a part of as well in the past several years with CASLPO. So with that, really excited to just be joining all of you back again. Thank you so much for taking the time out during your lunch hour to be here with us. I would like to start with a greeting of Ramadan Mubarak, Ramadan Kareem to everyone here who is of the Muslim background and participating in this month. It is a very special month for Muslims across the world as they fast from sunrise to sunset. And for all of us that are here today, I know there are going to be certain people who are participating in this month, and we wish you a very pleasant month, a month filled with blessings. So Ramadan Mubarak to all. We'd like to start off, as always, with our Indigenous Territory Acknowledgement, which I will read. Our firm recognizes that today's virtual session is taking place on traditional Indigenous territories, of which many of us are in different spots today. We acknowledge that there are many treaties and other agreements that cover the land now called Canada. We are thankful to be able to work and live in these territories. We are thankful to the First Nations, the Métis and the Inuit peoples who have cared for these lands since time immemorial and who continue to contribute to the strength of the country and all communities across the country. And there's also a link that I have on the screen here for you. I don't know, some of you may already be familiar with it, but it allows you to go in and look up the exact territory that you reside on. So if you aren't familiar with where that is already, I encourage all of you to take a minute today to be able to do that so that you know exactly where you are residing, where you are working from, where you are living. And I always ask us with this acknowledgement to pause and reflect for a minute, because we don't want to just do this and read it out before sessions or before meetings or before whatever it may be as something that just needs to be done, but rather understand why we're doing it. And so I ask us to take a moment to reflect on whether the land that you live on, you work on, you play on has an impact on you. Do you have a connection to it? And so forth. And I also want us to think today, giving some credit to our topic today on Islamophobia, on if there's a connection between us doing a territory acknowledgement and thinking about challenging Islamophobia. And the connection for all of us to think on is that addressing any form of discrimination, any form, any phobia that we're talking about, and striving for inclusion for all people is a shared goal. So let us keep that in mind and remember that the territory acknowledgement is not just to be said, but it's to be understood, it's to be felt, it's to be really lived on. For an optimal learning experience on our webinar platform today, Priya's already covered a few of the things. I just want to take a moment to recognize that that the content today may be triggering for some people, based on who you are, based on what your experiences have been, based on your identity, based on your practices. And so for some of us who have a little bit of a distance to today's learning and are not personally involved in these topics, they may not be as triggering as for some people for whom it is, especially for people who may have firsthand experienced Islamophobia or have been witness to it. And so I want us to remember again that the session is being recorded. If at any time you need to step away for your self-care, please do. And you won't be missing anything because you will have a recorded copy that you will have access to. I want us to hopefully listen respectfully. I know there are going to be comments in the chat box, so I want us to be able to read each other's comments in a respectful manner and to be able to respond if we do in a respectful manner as well. And I want us to lean into our own discomfort. And we say this in general in all work around, EDIB and so forth, to say that we do have to lean into our own discomfort and sometimes go into spaces that we normally don't go into or talk about and acknowledge. But also remember when we need a moment of care, like I said earlier, anytime you need to step away, we respect that you would step away. Engaging in an opportunity to learn from others and to learn in general is such a privilege, and I hope that all of you leave today with a little bit of a deeper understanding on this topic. That would be ideal. And always keeping in mind, this is not just a webinar a piece of advice, but just a life piece of advice to be open to new and different perspectives, thoughts, and ideas, because the learning journey truly never ends for any of us, regardless of who we are and what line of work we do. A quick snapshot of today's agenda with the short time that we have together. We're going to start off with a quick introduction on the Muslim community, go into discrimination and Islamophobia and the impact it has on health, and then look at some strategies on how we can deal with this. Because at the end of the day, we have to be able to address Islamophobia in healthcare and Islamophobia in general. Okay. Moment always, and I like having this slide with most of our workshops to be able to say, how are you feeling today? We are in the midst of a world where so much is happening in all of our personal lives and professional lives and the world at large, whether we look at the media or politics or conflicts, there's just so much going on that we really can't ignore. So I want us to take a moment always during the day, several times a day if we need to just check in with ourselves, to say, how are we feeling today? How are we feeling in this moment? To make sure that we are okay. A brief introduction to the Muslim community. And first, I ask all of us once again in a pause and reflect moment, what do you know about Muslims? I know we have a large group here today, and some people here may identify as being Muslim, other people may not. So I know the answer to that question is very different based on what your identity is and what your belief system is, and who you may know as friends and colleagues and other people. What do you know about Muslims? And what has helped shape your understanding? This is always interesting to see what shapes our understanding. Is it the media? Is it people in our lives that we know? Is it people that we work with? Is it people that we live with? Is it people that we have relationships with? Is it people that we've encountered at certain points in our lives and have played a part in our lives? So just always interesting to think about what we know about certain groups of people that may not be ourselves and what influences our thinking when we think about them. A quick global snapshot. Today, we are sitting at more than 2 billion Muslims worldwide. So in terms of a population, in terms of numbers, very, very large population spread out across the world. So this topic is important, I hope, in general for everyone, regardless of what your identity may be, but just really to understand that the magnitude of the topic is large because the population that we were speaking about is large. And so when we talk about Islamophobia, the impact that it has is on a lot of people because more than 2 billion people identify as Muslims across the world. And today Islam is the second largest religion in the world. By 2030, There are expectations that it will increase another 35% to taking us to just over 2.2 billion people. And many researchers who are looking at the trend are projecting that the faith may become the largest possibly in the world by 2050. So I hope that today's conversation is important for just everyone in, in general across our center here today. When we talk about Muslims, the concentration is, of course, higher in some countries than others, but of course, you will find Muslims in all countries in the world. I don't think currently we have in our statistics a single country in the world that does not have a Muslim population. Northern and Central Africa have a very high majority of Muslim populations. The Middle East definitely does, as many of us may be familiar with. South Asia and Southeast Asia both have a very high population. And when we say high population, these regions are often more than 90% Muslim. So other religions oftentimes are a minority in those countries. And of course, across the world, like I said, you will find your neighbors and friends and colleagues to be a part of this religion as well. When we talk about Canada, Islam is also the second largest, most reported religion in Canada as of 2021, with our statistics coming up in the future year. I believe that it will continue to remain the second largest as well, with 1.8 million, or just to give you a better idea, 1 in 20 people. So it just really gives you a good, very realistic idea of where how popular this religion may be and how often you may see it. In 20 years, the share of the Muslim population has more than doubled. So a part of that are people who live here, whose families have grown, but also a lot of that is also immigration, people moving in from different countries across the world. So a combination of that is what leads to our population increasing. And we are seeing an increase, like I said, from 2001 and definitely from 2021. So large increases there. In Ontario, where many of you may be residing right now, reporting about 6.7% of our population identifying as Muslim. So these numbers just give you a quick snapshot of the kind of population magnitude that we are working with. And of course, data always changes every single day, but these are the trends that we are looking at. And of course, when we look at studies around who Muslims are, who Muslim Canadians are, the University of Toronto's Institute for Islamic Studies often does very important work on this topic. And according to them, who are Canadian Muslims? Canadian Muslims are everyone. Canadian Muslims are geographically diverse, so we are in all provinces. Of course, Ontario is the highest, and then followed by Alberta and Quebec in terms of the 3 highest concentrations in our country. But in terms of, again, provincial numbers, you will see some in every province, varying levels of education like all other people. So you've got high school, undergrad, postgrad, graduate studies, and all, the whole spectrum. Age range as well, about 1/3 are over the age of 40, but you have people, of course, in all age categories as well, and speaking many languages. So not just English, but you've got French, Spanish, Russian, Portuguese, and many others. So here it just really reminds us of the fact that just like all other people of faith and all other groups, Canadian Muslims are everyone, whether it be religion or age or education or career or any other aspect that we look at, they are in all categories. Let us now focus on discrimination and Islamophobia, right? And I know that the term discrimination is not new for people, and Islamophobia, I don't know if it's new for people, but I hope today we get a better understanding of it. I'm going to go ahead and play our first video. We were having a little bit of difficulty with the videos on this platform, the GoToWebinar, unfortunately this morning, and I'm hoping that has changed and they've corrected whatever it is that wasn't working. So please, if you can't hear the video clearly, send us a message in the chat box, in which case I will turn off the video and you'll have access to it, of course, when you have a copy of the slides. But here's fingers crossed that it does work. Oh, sorry. Oh, it stopped. Sorry, I'm not sure what's happening here.
Nafisa, the audience is saying that the audio is still
It's not
difficult to
working?
hear. Yes.
Okay, not a problem. Thank you, Priya, for letting me know. Okay, I apologize. I'm not sure what is happening with the GoToWebinar. Okay, so why don't we go ahead and continue? This video really was about Islamophobia in Canada, and it talks about several of the incidences that we've had recently. So if the video is not working, then I think we're going to go ahead to the next slide and hope the next video works, but we will share the video with you, like I said, but we're going to make sure that you have access to it. Okay, not a problem. And the video was interesting for us because it really highlighted recent incidences, including the London family and so forth, but you will have access to the video. And I do ask all of you, if you have a moment today while we're still in the midst of this topic, that you are able to watch it at that point. All right, Priya, do we have the slides back on? Are people able to see the slides again?
Yes, we're on definition of Islamophobia.
Perfect. Thank you so much. And apologies to everyone. I'm not sure if technology sometimes fails us. So when we talk about the definition of Islamophobia, and I think many of you may be familiar with the concept of Islamophobia and what that may mean, what that may look like, and so forth. But I do want us to just also have a more formal definition. It's not just, it is, yes, an irrational fear and hatred of Muslims, but it's not just that. It's also stereotypes. It's also biases against the Muslim population, people who follow Islam. It's acts of hostility. And when we talk about acts of hostility, there's so many shapes and forms in which that takes, whether it be towards individual Muslims or whether it be towards Islam in general or towards larger groups and so forth. So when we talk about individual acts of intolerance or racial profiling, Islamophobia leads to thinking about Muslims, viewing Muslims as a greater security threat. It's not just a one-on-one in that moment comment. It talks about institutional issues. It talks about systemic issues. It talks about societal issues. So when you think about Islamophobia, I want you to think about the magnitude of what that looks like. Just like with any other phobia, you're not just touching, impacting, hurting one person in one moment. You are oftentimes going further than that. You're going into groups, you're going into systems, you're going into organizations, you're going into policies and programs that are impacted by all of this. And there are many direct forms, of course, of Islamophobia that we may quickly, think about when we're thinking about any kind of phobia. And oftentimes they're insensitive remarks, they're sometimes acts of violence and so forth. They're microaggressions that are very, very macro in their impact. But you're also thinking about the indirect forms. And what does that look like? It's oftentimes not having halal options at a restaurant, or having people of a certain dress code wanting to be in certain events or so forth, and not allowing people who look a certain way. So there are many ways in which Islamophobia is very loud, where we make it a physical action or a verbal word. And there are many ways in which it is more hidden, in which we see it in our policies and our programs and in restrictions that we have towards certain people joining certain things, certain activities and so forth, and biases and so forth around there. And sometimes they're conscious, sometimes they're unconscious, but they are present and they have an impact and they are harmful. Stereotypes, all of you will know definition of from all the previous sessions that I've done with you. And when we think about stereotypes in this moment, stereotypes typically involve attributing some characteristics of any group to all members of that group. And so I oftentimes say that stereotyping is like pigeonholing people into a certain box. You've got certain boxes in your head for different people, for different backgrounds, different races, different religions. And what we do when we stereotype is we dump everyone from a certain identity into that one box. So if you're a Muslim, you're going to go into that box. If you're a Christian, you're going to go into that box. If you're South Asian, you're going to go into that box. So whatever it is that you are thinking about when it comes to one person in a group, you are associating with everybody in that group. And just as I am speaking, I'm sure you can realize the danger of that. the danger of not recognizing people for who they are and attributing the same characteristics to everybody in a group, because we know that that is not how things work. Stereotypes are often based on misconceptions, so we don't really know who somebody is, incomplete information, or very clearly and loudly false generalizations. Whenever we are generalizing an entire population, especially one that is over 2 billion people, we are bound to make many, many mistakes in who they are and what they are. And once again, this goes to people of all different religions and faith and backgrounds to say we cannot stereotype any group, because every single person is an individual on their own, regardless of what their faith may be, what certain aspects of their diversity may be. And when we talk about stereotypes, they're not just ideas in your head that aren't going to impact anyone, that aren't going to hurt anyone, but they've been embedded once again in institutions. So our stereotypes, from what we're thinking, then play out into actions, into our organizations, the policies and programs I just mentioned, and really looking at the structures and environments and cultures that display certain members in a certain way, and in this case, in the case of Islamophobia, the Muslim community in a very negative light. And this image, I think, is a very clear, simple one, right? How often do we hear, "Where are you from?" No, where are you really from? And then why don't you go back to where you came from? And well, what tempts us to say this? What are we stereotyping people as to be able to say, you don't belong here because you look this way, or because you believe this, or because you're from here and somebody else does, right? Some examples of Islamophobia in healthcare. And some of these you may have been privy to in the work that you do. Some of them you may not have. So here, this comes from a CBC source again, and many of you may have heard similar things. So here, a female patient shared that you feel that they think you're stupid and you don't know anything about this world. And when you say you feel it, there you go with a microaggression, or perhaps a bias, or perhaps a comment that someone's made, that are actually landing on our patients in a certain way that we never wish for anything to land on any patient or any person in general. One woman wearing a hijab said that they sought medical care, and the staff member spoke to a family member who wasn't wearing a hijab, instead of speaking to her, who was the patient, as if they won't understand the physician. So here we are taking our stereotypes to think that if somebody is dressed in a certain way, if they're wearing a hijab, which is a head covering, that perhaps maybe they don't understand the language, or they don't understand the concept, or they don't understand what is happening within our medical system or in their own medical care and treatment, and so forth. So when we think about these comments, and when we think about how through our actions or our words, or maybe a look, or maybe a comment that we've made, we are making our patients feel, we really have to take a moment, and we have to really understand what we are doing and how harmful this is for people that we are meant to protect and meant to take care of. A doctor wearing a hijab described an encounter where a doctor in the ER who explained the health system as if she was new to Canada. Meanwhile, she was born and raised in Hamilton, Ontario. Once again, the head covering, the way that people choose to dress, the certain things that people choose to wear, how they carry themselves, has a very large impact in the type of stereotypes that they receive, in the type of biases towards them, in the type of microaggressions towards them. So it's very, very important for us to make sure that we challenge ourselves in making sure that we are not participating in that type of behavior. An Oakville endocrinologist who specializes in bone disorders shared an experience delivering a lecture at a medical conference where she was looking through the attendees' feedback forms. One doctor had written, "Go back to Saudi Arabia." And so again, this is not just people who are not perhaps educated or informed, or participating in our workforce, or maybe negligent in some way. These are our physicians making these comments with their colleagues. So when it comes to a concept like Islamophobia, or phobia in general, keep in mind that it's not just reserved for certain types of people, or just certain types of people engage in that kind of behavior, or certain types of people who are ignorant make those kind of comments. We are seeing this across all platforms. We are seeing this coming from patients, coming from professionals, coming from colleagues, coming from all groups in society. And that's what really makes it that much more disheartening, but that much more important for us to be able to combat. And I want to take a second here because I know we're talking about a lot of things, and just to ask people further questions, for comments, even if not a question. Does anyone have a comment? Does anyone have an experience they want to share that they're willing to type out? I know it's different when you're not just able to speak directly because of a platform like this, but have any of you experienced Islamophobia? Is this personal for some people who are here? Or do you know some people who have been impacted? We all know that if certain things are personal for us, they land differently. Education lands differently when it's personal for us versus something that we're just learning about other people. So I welcome comments. I believe I have a box here that I can click on to be able to see them. Thank you. Let me see if I can, Islamophobia experiences. Thank you, Priya. There we go. But any comments at all that you're able to share in the box, I welcome all of you to be able to share. If at this moment you have anything at all, like I say, while this is being recorded, it's a safe space. I hope it's a safe space for all that all of you feel. And even if not a comment that you would like to share in this moment, I want all of us to be able to think about this. I don't see any comments in the chat box right now, if I'm not mistaken.
No.
But Priya, if they come in,
nothing has come in.
Okay, perfect. So Priya, if they come in, please just, let me know, because we can stop at a different point as well. Just to be able to say, I know that sometimes it takes a moment, and I know these things are personal. We may be in a professional context today, in an organizational context, but these things are personal for people. So I know sometimes we have a little bit of a hesitancy around being able to share personal experiences. But even if you have seen someone else impacted by it, or can resonate with some of the comments that we just read out.
Sorry, Dr. Jalal, there are some entries that are coming in. I can go ahead and share on behalf of folks that have sent them in. So there is an individual that said that they have experienced always being randomly selected at the airport. There is another entry that reads, I have experienced white privilege. I'm half Arabic, but my full name at birth was white sounding, and I am often mistaken as fully white. So I have heard negative comments about Arabs and Muslims without the speaker realizing my background. There are a bunch of folks speaking about witnessing discrimination on the basis of Muslim women wearing their hijabs. And there are also folks saying that they have not been giving accommodations for Muslim practices such as fasting and prayer.
Thank you so much, Bia, for reading all of them. And thank you to everyone who sent out those comments. And I think you speak for so many other people when you share these experiences, because they're not things that only you are experiencing. They're things that many people experience. The airport one, I can speak to personally. Ever since 9/11, I will say, I don't think I recognized this so much before 9/11, or even if experienced, but ever since 9/11, which mind you was a very, very, very long time ago, every single time that I travel into the US, and most of my family lives in the US, so I travel very frequently to the US, I don't think there has been a time where I have not been, quote unquote, randomly selected for an extra security check because I have a prominently Muslim name. And I'm thinking, really? It's been this many years, even if structurally some of these things were put in place back then for the sake of, whether they said security risks or whatever their explanations were, there have been enough years that have passed for us to be able to recognize when something is a security threat and when something is a bias or a microaggression or discrimination or racism, and really being able to differentiate within that. But when we talk again about the structural, like we just mentioned earlier, some of these things, once they enter a structure, once we have a policy or a program or something that is built into a structure, to be able to take that out takes a very, very long time if it does come out. So I definitely can resonate very personally with the individual that shared the airport experience, because I face it every single time without fail. And I always bet with my husband to say, I wonder if this time they'll miss it. Nope, Nope, they're gonna have to wait on the side while I go get my check done. And with the other experiences that you've shared as well around the clothing and so forth, people I think can very much resonate with the kind of discrimination that comes for people who choose to wear a hijab. Even though we're seeing this every day around us, even though all of us recognize that people are allowed to dress in the way that they would like to dress. And there is no bias or microaggression or discrimination that anyone should have to face because of these things. And so they're very loud. And so when you share these experiences, you speak for a very large group of people and a lot of people who face this. Now, when it comes to the fasting and the other accommodations, as we are sitting here in Ramadan, I do ask all of us here to be respectful of this. Thank you for bringing up this example because it's a very relevant one in this month, to be able to say you will likely have colleagues. I know you're in a hybrid structure now, not everyone's in the office every day, regardless of where you're working for most people, but you will likely have access to people who are fasting and people who have certain prayer times and so forth. And so I ask all of you to make sure that you have a heightened sense of consciousness and of course respect, and accommodation is not difficult when it comes to these things. When you're scheduling a meeting and you've got food out, recognizing that there may be certain people joining that meeting who are not going to be eating because they're fasting. When you have a meeting at a certain prayer time, maybe recognizing that someone may need to step out for a couple minutes to do their prayer, to do their namaz, and then come back again. So very important for us to, as we're having this session, hopefully get into action some of the things that are important as we combat Islamophobia, but also as we just simply gain a greater sense of inclusion among everyone, a greater sense of respect for people of different backgrounds and different practices and different cultures. I promise you it is not difficult. It is simply about a mindset and about making sure that we prioritize making sure people are comfortable, making sure people are able to do what they have to do while still in our professional workspaces. So thank you so much to everyone for their comments. And like I said, if there are other points in which they're coming, please, Bia and Priya, stop me and we can speak about that as well. Discrimination is not a term that I think is new for anybody in this audience at all, especially because of all the sessions that we do together. But when we talk about the Ontario Human Rights Commission, they have a formal definition. It includes any action, and this is important to note, intentional or not. Intentional or not. So you may have made a mistake and not intentionally done something to someone, or you may have, that impacts people or groups of people by singling them out, by imposing burdens on them that are not on others, by withholding or limiting access to services. And that's where it gets dangerous. Education, whether it be healthcare, whether it be housing, whether it be any sector at all. And so the Ontario Human Rights Code covers and officially on paper protects from this type of discrimination, but it's really on us to make sure we take the paper, we take the written words, and we actually implement it in what we are doing in our workplaces, in our work, in our interactions with other people. And the last line here is important as well. Discrimination may take obvious forms, but very often it also happens in very subtle ways. So it's not always that you're going to have somebody physically assaulting somebody, or somebody physically saying something derogatory to somebody. Many times it's going to be in these underlying issues. Many times it's going to be in moments like an airport where they say, sorry, can we just, we're doing a random security check, and, and it's as random as every single time you travel, but it's subtle within our system. So I want us to be conscious of the both, of the loud, but also of the quieter moments where this is happening to us, to our colleagues, to our friends, to our family members, to people in our community who we share our lives and our home with. And when we talk about, like I said, the Ontario Human Rights Code and the groups that it protects, all that you're seeing in front of you, but it's really on us to make sure that we put this into practice. It's not something that we're just reading about and learning about and is, in our documents, but it's something that we live by. And when it comes to Islamophobia, like you see, it's not just one thing. It could fall under several different categories, and that's what's important to note as well, and makes the magnitude of the issue that much larger. Creed, color, ancestry, and race can all fall under people who are going through some of these things, who are Muslim, who practice Islam. Creed, different things to different people, and it does evolve over time, but really generally it includes beliefs or worldviews that are very deeply entrenched, deeply held to how a person defines their identity, who they are, their surroundings. It's oftentimes can also be tied to an organization or a community with a shared belief system, okay? Color, as we know, refers very physically to one's skin color. Ancestry, we're looking at a common heritage or place of birth oftentimes. Race, socially constructed differences. And those differences can be in so many different forms, whether it be speech or our names or our clothing, diet, practices, beliefs, and so forth. So when we think about people who are Muslim and Islamophobia, we have so many different areas in which they can fall for which they're experiencing what they're experiencing. Discrimination and oppression, not just for Islamophobia, but just in general, exists across levels of institutions, of our structures, and really of even our interactions one-on-one. And all of these things become interconnected over time. They're not separate pieces. So when we talk about an individual person's beliefs or actions that serve to perpetuate oppression. So it's something that you believe, something that you're doing for which you are having to face certain things, right? And this can be, like I said, conscious or unconscious, and it can be externalized or internalized, something that you're feeling. And then you've got on the other end, the institutional and the structure that we just spoke about with the airport example and so many others. It can fall under schools and it can fall under hospitals as they do every day. And when you think about institutions, we're talking about policies and practices that are put in place that, whether knowingly or unknowingly, are perpetuating oppression. And when you think about the structural as well, and think about how the effects of it are interacting and accumulating across institutions and with structures, you're talking year after year after year. So across history, across time is when these things are embedded and become even stronger. And then in the middle, we have our interpersonal. And these are interactions between yourself and myself, between each other, between you and your colleagues, and so forth. And so when we look at the intertwining and all of this, you understand that you've got several different types of discrimination, and when they combine, they're ingrained in every fabric of our society. Hate against the Muslim community in Ontario. The Mosaic Institute, an organization and NGO in Ontario, in Toronto, has conducted a very important piece of research this year. And around April and May, they looked at hate in general in Ontario, not just Islamophobia, but just hate in general, because so much of it has been so loud in this past year. And so they looked at surveying people, and they looked at who was accessing services how, and the survey designed really an access to hate in terms of what are people's personal experiences, what have people been seeing in other people, what have people been seeing increase around themselves in communities and so forth. And what were some of the results? Muslim participants identified that they experienced hate at a higher rate in situations involving in-person spaces. So when somebody is physically there with somebody else, you're seeing more of this. When applying for jobs or promotions, or even in educational settings. So really something to think about, especially because all of this applies to us. You know, here at CASLPO, when we're talking about in-person spaces, we do interact with our patients, with our colleagues, with our stakeholders, with our people. We do with the public. And so what does that look like for us? Applying for jobs or promotions within our organizations, in educational settings. The experiences of hate explained by Muslim patients was due to their race, ethnicity, religion, and clothing. And I know clothing we've mentioned a few times, because how somebody dresses oftentimes has biases coming towards them, and microaggressions coming towards them. And of course, race, ethnicity, and religion are oftentimes combined. People will look at someone's clothing or how someone's dressed and associate a race with them, or associate an ethnicity or religion with them. Muslims participating also noted that they experienced religious vandalism at higher rates than non-Muslim participants. So when you look at all of this, and you look at the fact that we are in 2024 and we are in a province that is incredibly diverse in all aspects and spectrums of the word diversity, and in a country that is diverse, and in a country that is meant to welcome people from all over the world. And we look at these trends. I personally find them very disheartening, very frustrating, and scary. And scary because there's so much going into us trying to foster a sense of inclusion, foster a sense of respect for all in all communities across all faiths. And yet it seems like sometimes we take 2 steps forward, but 4 steps back. And so I hope that in moments like today, in sessions like today, we are able to generate a new sense of direction and really a sense of commitment to be able to say no. Not here in my province, not here in my country, not here in my practice, not here in my sector, not here in any aspect of something that I'm associated with. The impact of the pandemic when it comes to hate in Canada, and of course we know the pandemic has exacerbated a lot of negative aspects for many aspects of society, whether it be poverty and so forth. And of course, when we come to racial issues, we face that as well. When it comes to discrimination, a surge of hate across various communities, such as the Muslim community. And this has impacted people's access to social supports, not just healthcare, but social supports in general. When we're talking about racial communities, racialized communities facing additional barriers, when it came to the pandemic, it was about accessing vaccines, which was meant to be something that everyone was meant to have very mandatory access to. And these barriers were compounded by historical examples of institutional racism in our healthcare sector. And all of us here today, I believe, are a part of the healthcare sector in a very important way in some way. So you are not new or foreign to institutional racism in our healthcare sectors. I am not new to this. You are not new to this. Those of us that work within hospital settings or clinic settings or private practices or are associated with health colleges are not new to the fact that this is something that is playing out for our patients and our public. I want to bring our attention to the concept of intersectionality for a second. Again, all of you are who have been here on past sessions are very familiar with this concept. I bring it up in all of our workshops to remind us of the importance of it, especially when we are talking about caring for the public. Intersectionality is a framework where the multiple aspects of our identity, of who we are, compound to be able to create our experiences. Right, so I always give my personal example to make it a very clear one. So for example, if I said I'm female and I identify as a female, what is my experience in life? And then if I compound that, intersect that with, say, my religion, to be able to say I identify as a Muslim female, now how do my experiences change? When I add another layer to it, whether it be race, to be able to say South Asian Canadian, and I compound that, what direction does my experiences, and does my identity and so forth go into when it comes to that? So each one of us here, each one of you and your patients and anyone that you come in contact with has layers and layers of intersectionality. None of us are just one thing. So whether we talk about our education, our race, our religion, our gender, our marital status, our sexual orientation, our age, all of these things compound on top of each other in order to be able to truly define what our experiences are. So we cannot look at people as just one thing. We cannot look at a patient and just say, oh, this patient is, this person is Muslim or Jewish or Christian or Sikh or Hindu or whatever their religious identity may be, or not practicing or so forth. We have to understand that there are layers and layers and layers that go into who people are. So the concept of intersectionality must also always be kept in the back of our mind as we are providing services, as we are interacting with people. So then, why is intersectionality important to remember in providing inclusive care to Muslims and other communities? Because intersectionality defines all of us. And we cannot look at a person and just look at one aspect of them and expect that the care that we provide to them based on looking at just one aspect of them is going to be inclusive. We must look at people as a whole and their experiences as a whole. Okay? And I have a video here again that I'm fearful of putting on. I'm going to play again, and Priya and Bia, please tell me again if it works. I apologize. We have not, I don't think, faced this with this platform in recent times, so we weren't expecting this, but I will go ahead and play it. And if I see the chat box flashing, then I will go ahead and do that. Thank you, Priya, as well for the 15-minute warning.
What is intersectionality? Intersectionality difference about the Muslim woman policy is expressed from the area of development. We describe the opposite
Visa,
Yes,
it's still coming through garbled.
same issue, eh?
Yes,
Oh,
unfortunately.
So
Bia
disheartening. This was
has
such a
put-
great video.
Yeah, Bia has
Okay.
put in the chat feature links to the videos,
Okay.
and we will circulate it after the fact.
Okay.
But I'm sorry, it looks like it's not going to work for us today.
Not a problem. My heart is a little bit broken because I really wanted to watch these videos with all of you, and I really do ask all of you to please take a moment to watch them. This last one was on intersectionality, and it was an animated video, and as you watch it, you'll see that it talks about, okay, I'm not going to give it away, but please do watch the video and understand that it demonstrates intersectionality in terms of a doctor and a patient in a medical setting, and it really showcases the importance of why intersectionality is important, because people, whether they be physicians or patients or the public in general, have very different experiences, and when we consider intersectionality, the experiences that we give them are very, very different than if we don't. Okay. So with that, I will continue, and I know there's one more video that maybe I'm not even going to go ahead and play, but thank you so much for bearing with us. So with that, I want us to remember that Muslims in the Muslim community, like people of any faith, cannot be considered a monolith. So it's not just everybody stereotyped in the one box, but rather they are diverse, and the way they practice is diverse, and outwardly exhibit their faith is diverse as well. So it's very hard for us to be able to say, okay, well, we know what everybody from that faith looks like because they dress like this, or they look like this, or they sound like this, and so forth. It's very important for us to understand that there is so much diversity among this religion as there is in people of all religion and all faiths and all backgrounds, no different from that. Excuse me. Islamophobia and its consequences on patient care. And I know we've been speaking about this as we're going along as well. Excuse me. The impact of discrimination on patient care. And this is loud, I think, for all of us because we all belong to the healthcare sector in some way or another. And overall, it's no surprise for us that discrimination, any form of it, can exacerbate health inequities. And we already know that we work with a system where there are many health inequities already put in place, and many groups are already very conscious and very hesitant to be able to access formal services. And so when we talk about this, there are systemic differences in health between groups of different people. There's also, of course, an increased risk of long-term health conditions because certain discriminations are going to either lead people to not accessing services or accessing very poor services, mental health challenges that are associated with this, diminished lack of access to services like I just spoke about, or even, like I said, the quality of care that they're receiving. So when we have discrimination put into a system where already we are trying to tackle inequities, where already there are many groups of our population who are very hesitant to access services, and should they access services, that they face any of these things that we're talking about today, it exacerbates the inequities, yes, but also really tarnishes their experience, and perhaps they're not going to be returning or returning when they need to return. Research shows again and again that healthcare professionals can sometimes have ideas about services, about users, about patients, who do not share their personal identity. And this goes in general to just biases and unconscious biases even for all of us. To be able to say in general, when people are similar backgrounds to us, when people look the same, sound the same, when there's an affinity to us in different ways, we oftentimes treat them in a certain way. And when there are people who have very marked differences to us, we have different ideas about them. We have different ideas, and sometimes those ideas fringe on very negative ones and result in bias and discrimination and microaggressions and so forth. And when we do this, the consequences of their care is very different as well. These ideas inhibit healthcare professionals from understanding the multi-pronged causes of health needs for equity-deserving groups. And so we have to understand that as professionals in this field, Whenever we see discrimination, of course, we have to tackle it, but we also have to make sure that we are not the ones bringing it to the table. The impact of bias in patient interactions. Of course, there's going to be negative impacts to that. When we think about interacting, and there's been people who've been on the receiving end of bias and microaggressions and discrimination and so forth, there's decreased trust in the system. There's decreased trust in the provider, but also in the system in general. Patients developing a negative association with medical care, like we just spoke about, or not even receiving appropriate care. So it's just either patients will not want to access services, or people will just, on the receiving end, providers will not provide the type of care that needs to be provided. Fear of being measured against a stereotype or a bias, increased chances of misdiagnoses. So many patients have said, we've gone in, we've been misdiagnosed, we've been treated in a certain way, we are not going back. And so we have to really think about the negative impact and the long-term impact of this bias. Yes.
Sorry, just very quickly, you have 4 minutes before 1.
Okay, all right. Let me see how quickly I can go through the next thank you so much, Priya. This study, I want us to quickly take a quick glance at from McMaster and the Muslim Advisory Council. It's a very important study with a review of 14 peer-reviewed studies, and it really shows people's experiences, once again, similar to the quotes that we read out earlier, of people being visibly marked, of being treated dismissively, late diagnoses, offered less appointments for specialized care, and so forth. Let us not forget the impact that it has on healthcare professionals as well. We're not just talking about patients and their impact on that Islamophobia has on them, but healthcare professionals as well have to face a lot of this. I'm not going to play this video from Islamic Relief. It's an excellent video. I please encourage all of you to watch it today. And I think it'll really sum up the session for all of you, even if you were to take 2 minutes after the session to watch it. I want to leave us with some strategies to address Islamophobia in healthcare. And I think these are going to be strategies that you can use for all types of phobia, not just Islamophobia. But of course, like I said today, let us focus on this topic, but make sure we do it across our work. Speaking up, making sure that we are not bystanders. When you see Islamophobia put in action, when someone has a comment towards someone, is behaving in a certain way towards someone, speak up, stand up. Maybe that person in that moment is not able to right then, but you are. Ask what your Muslim patients, your colleagues, people that you associate with need in the time of an Islamophobic incident, but even going larger than that to this month of Ramadan to say, is there any way that I can support you in this month? Is there anything that I can do differently? Learn about your own biases, please. I know oftentimes we talk about these topics as if they're somebody else's problem, somebody else doing them, but it really is us. We are the somebody oftentimes. And so all of us need to be conscious of our own behaviors. CASLPO has a very important guide that we were part of as well, and I encourage us to be able to look at it. Principle 3 in the guide has some important notices for bias and unconscious bias, and I think it's a very important one. When we're talking about addressing discrimination in our interactions, understand that if you've done something that is derogatory, that is incorrect, find a way to speak about it and correct the actions and focus on the why of why it's happening. Be aware of yourself, of others, and really in the importance of that interaction and of that relationship. And also recognize that discrimination may bring out certain feelings for you. You might have certain discriminations, you might have felt certain things that are now impacting you to behave in a certain way, and take stock of that and the support that you need as well. Cultural competency and humility are things I want us to keep in mind all the time. The continuous nature of learning about other communities, other faiths, people of different backgrounds, and effectively finding ways to interact with all people around us. And again, CASLPO's principle 2 in the guide is also an important one that I want you to notice around cultural competency and humility. Here is a quick snapshot. You'll have the slides for us to follow, where we have to start with our own worldviews and our own awarenesses, where we have to look at the attitudes we have towards different cultures, where we have to build our knowledge base, where we have to make sure that we develop the cross-cultural skills that we need in order to continue learning about other people and caring about other people in the way that they need to be cared for. And so some cultural competent practices that foster inclusion, and again, go with all communities as well, strong communication, making sure you have rapport, making sure that when you're in a caregiving role, that you have that relationship built with people of all backgrounds, to really be able to understand them in their fullest way, to be able to provide different supports, and really being able to understand that people practice differently. Any religion, any people of any faith that you're going to talk to, there's going to be diversity within, and it is very important for us to understand the diversity within, and also to be flexible when we are providing our services and treatments, realizing that not everyone is visibly going to look Muslim or visibly going to look Jewish or visibly going to look Christian, and that doesn't take away our onus of providing them services that are culturally, religiously appropriate as well. And principle 1 in our CASLPO guide is also a very important one. So I know that was me speaking very, very fast. Our time together is never enough. But Priya, thank you so much. I'd like to hand it over to all of you. I don't know if any of you have a question or a comment that I can address. I know our time officially is up, but I welcome it just the same. And thank you everyone for just being here, for being a part of this conversation, not just during this month of Ramadan, but I hope that the phobias that we tackle in our work, in our services, are ones that we deal with across the year, throughout the year, and every day of our work. Thank you so much.
Thank you, Nafisa. That was wonderful. I know we are at time, so I'm only going to throw one question at you today. And the question is, how can audiologists and speech language pathologists support Muslim colleagues who may be experiencing discrimination in the workplace?
This is such a brilliant question, and I wish you would give me 1 hour to go through so many different strategies. I think what I'm going to say is start with some of the ones that we've mentioned here today. So as SLPs and audiologists, when you look at some of the things that we provided here, and my slides are not moving fast enough, when we're thinking about our strategies, ask them. First of all, knowing that you, if you're not a Muslim person, are an ally is very, very important for your colleagues and people to know. So when you see anything happening in action, you stand up. But when you're talking about supporting, ask people simply, how can I support you? And for some people, it might be, well, you know what, our office doesn't have a prayer room, and I'd really appreciate that, and see what you can do about it. For some people, it might be, well, can we schedule meetings at a time that is not this time or that time, and make that accommodation, and do that. For some people, it's going to be very small things. For other people, it might be a couple of things that you might have to adjust around your schedule and so forth. But the best way in supporting any community ever is really reaching out to them to say, what can I do? And oftentimes you're going to get the best responses there, and you're not going to have to guess to be able to say, well, I think they need this, or I think they need that, when someone might say, no, we don't. So I would say this is a brilliant question, and I love that you've asked it. And that's where we have to start, with simply asking people to say what. And in an organizational way, what you can do is you can send out an email to be able to say, is there something that we can support you with during the month of Ramadan, or during the year, or just in general when it comes to Islamophobia, and see how people respond. And I think that's always going to be the best strategy. And of course, on top of that, being conscious of your biases, making sure that the questions that you're asking people are respectful. And if you aren't asking something that's respectful, or have asked something that's not respectful, making sure that you're able to apologize and take that conversation forward to understand what you have done wrong. And really, the cultural competency and humility piece is one that I'm going to focus on, all of us again, as you're looking to provide supports to people around you, but just in general, to be able to say, learn about other people, learn about their backgrounds. It's interesting and it's important. They're both sides of the same coin. And to be able to say, what can I do? If you have a strong communication and rapport with people around you, and to be able to say, if there's anything that you need, I'm here. That sometimes is everything that any community will need, whether Muslim or otherwise.
I think that's fantastic. And I want to thank you for such a wonderful and thought-provoking presentation today. I think it's fair to say that this has broached a conversation that is important to have, and I hope that all our viewers today have received at least some takeaways in terms of what we can do for positive change going forward. Just to close off, as mentioned earlier today, the recording of today's session will be posted on CASLPO's website, where you can also find the recording of our first session, Addressing Anti-Semitism in Healthcare. Please join us on May 8th for the next session in the series, addressing anti-Asian racism in healthcare. And then, of course, in June, our fourth session will be discussing 2S LGBTQAI+ hate and transphobia in healthcare. If you have not already signed up for these sessions, please watch for reminder emails that will be circulated shortly. I'd like to thank you today for joining us and hope that everyone has a wonderful afternoon. Finally, I'd like to echo Dr. Jalal's wishes. Ramadan Mubarak to all of those who are watching today. Have a wonderful afternoon, everyone. Thank you.
Thank you so much.